What is West Nile virus?
West Nile virus is a single-stranded RNA virus that causes West Nile fever. It is a member of the family Flaviviridae, from the genus Flavivirus, which also contains the Zika virus, dengue virus, and yellow fever virus. West Nile virus is a type of virus that's carried by mosquitoes, and it can make both people and animals sick.
How is West Nile virus transmitted?
Nearly all cases of West Nile virus are contracted through the bite of a mosquito carrying the infection. West Nile virus can also be acquired from a blood transfusion or organ transplant. The risk from blood transfusion is very low because testing for WN virus is routinely done since 2003. Because birds are the primary hosts of the disease, contact with birds that are dead or ill should be avoided. West Nile virus is not spread through touching, kissing, or sharing utensils with a person with the infection, or through contact with a healthcare provider who has treated patients with the virus.
What are West Nile virus symptoms? 1. West Nile fever. 2. Severe neuroinvasive disease. About 25% of people who contract West Nile virus develop West Nile fever. This is a self-limited illness, usually characterized by fever, headache, tiredness, back pain, muscle aches, decreased appetite, and rash. Other symptoms can include nausea, vomiting, diarrhea, and abdominal pain. These symptoms typically last from a few days to several weeks. Less than 1% develop severe neuroinvasive disease, in which the virus travels through the blood and infects the brain and spinal cord. Signs and symptoms of severe disease include headache and fever, as well as disorientation, convulsions, muscle weakness, coma, and paralysis. These symptoms can last for several weeks and long-lasting neurological abnormalities can develop. At 1 year, less than 40% of patients with severe disease achieve a full recovery. Only about a third of patients with paralysis will fully recover. In about 10% of cases, severe neuroinvasive disease results in death.
How is West Nile virus diagnosed? Blood tests in patients with West Nile fever may be negative if blood is drawn within the first week of illness. Later testing can help confirm the diagnosis. For most people with neuroinvasive disease from West Nile virus, a blood test for West Nile virus is positive within about 1 week of the first symptoms. Cerebrospinal fluid can also be tested if neuroinvasive disease is suspected.
How is West Nile virus treated and prevented? West Nile fever generally improves on its own. Severe disease may require hospitalization for monitoring and support. There is no specific treatment for West Nile virus. The best way to protect yourself from diseases carried by mosquitoes is to prevent mosquito bites and reduce their breeding grounds.
Avoid mosquito bites. Use mosquito repellent that's been approved by the Environmental Protection Agency when you're in areas where mosquitoes are present. Make sure to read the label and follow the instructions carefully. Put screens on your windows and doors, and fix any holes in them to keep mosquitoes outside. If you can, stay indoors during dawn and dusk when mosquitoes are most active. Cover up with long-sleeved shirts, long pants, and a hat when you're in places where mosquitoes are around. You can also treat your clothing and gear with a substance called permethrin to either kill or repel mosquitoes.
Reduce mosquito habitat. Mosquitoes need water to lay their eggs, so it's essential to get rid of places where water can collect. This includes things like old tires, buckets, planters, toys, pools, and bird baths. If you can, empty any containers that collect water. If you can't empty them, cover them up or change the water at least twice a week.
Thank you for listening. Subscribe to Diseases Simplified for more health tips and updates.